to my guest who's here sitting with me. I have Sanjida Alam. She's 26 years old, and honestly, I just can't believe how amazing she is. She's an entrepreneur who already has two businesses, and is currently building out a digital healthcare startup in Bangladesh called Soowgood. So I'm so happy that you're here today. Welcome, Sanjida.
Thank you very much. Thank you for inviting me.
No, well, do you know, I'm so excited to learn more about your business. But before we go there, you're 26 years old and you've already had two businesses. Can you just, before we go into what you're doing now, can you just tell me how and what they are?
Yeah, of course. Thank you for the introduction. You're too kind. Actually, I've had a very early start. I moved to the UK when I was 10, and I've always aspired to become a doctor. I've had this dream to sort of go back to my city and sort of, treat patients. And then, so I did my education and everything here. But unfortunately, I couldn't get into medicine or medical school. So I ended up doing biomedical science. But 6 months within the time, I absolutely hated biomedical science and being a scientist and working in the labs. So I had to sort of do something good with the 4 years of university. I wasn't going to quit or drop out. So that's when sort of I entered into entrepreneurship. I founded my first business at the age of 19.
Wow.
An education center in East London. With just a genuine intention of providing high quality and low cost tuition services. I live in an area where parents are extremely ambitious about their children education, but they couldn't afford a lot, or their purchasing power was very, very low. So I gathered my friends who were, high achievers in their subjects to teach that particular subject to younger students, help them out of school setting. So I saw very early success, and so that sort of business, ran part-time, gave me a bit more time to focus on something else. Right sort of in 2019, I founded a travel agency in Paris with a social sort of impact side of things, to provide a low-cost travel fares to expats and international students living in Paris who travels back home every year. And that's also sort of ended up doing very well. But Kuhinoor, my passion to become a doctor deep down was still in there.
Right.
So that's sort of what triggered me to start researching on digital health, or not even digital health, just on healthcare challenges, right? Mm-hmm. And so I started researching on different challenges and social aspect of the challenges, cultural aspect of the challenges, and what are the possible, potential solution can be without building a hospital or any sort of physical infrastructure. How can I build a sustainable solution? So that's where sort of it came about.
So talk to me about what you're actually doing. I mean, so talk to me about digital health in particular and why Bangladesh.
Sure. So digital health is not a sort of a new thing. Telemedicine is not a new thing. It's been here for a very long time. So my main concern was, okay, why has it not done very well in Bangladesh? Why has not been integrated socially in patients' day-to-day care? So, healthcare challenges are prominent around the world, whether you live in America, UK, Bangladesh, wherever. But I am a firm believer of the fact that innovation should be made in places where it has a greater impact, and no better place than rural communities of Bangladesh. So I had to go, and my research mainly involved researching on, okay, why these, challenges still exist, right? And how can we build a solution? And one way, obviously, is to do with tech. Why? Because if I build a hospital, that's only for that particular area. But how can I build a technological-based solution that can be that's firstly sustainable, so that can be used for a long period of time. Secondly, that's scalable. So how can I scale it to every corner of Bangladesh? Mm-hmm. So that was the main concept.
So how does Soowgood make a difference in people's lives at the moment in rural and urban areas in Bangladesh?
So to answer that question, what you have to understand is what happens now,
Yeah.
right? So you're someone who lives in a rural sort of community or semi-urban community area in Bangladesh, right? Your nearest hospital is at least 5 kilometers away, right? And doctors usually visit there once a week or once a month. But when you have health concern, your health concern don't wait for 15th of next month when the doctor will come. So we had to then figure out how do we, main concern is that, okay, we had to make sure the doctors are available whenever and wherever patients need them. If you woke up 6 a.m. in the morning with a tummy ache, you should be able to speak to a doctor within 5 minutes. The second challenge is that how do we make that happen in rural communities where digital literacy is so low, right? So what we did now, we had to understand what do you do currently. Doctors are not there. So you end up going to your local pharmacist, right? And you ask them, Bhaiya, give me medicine. My child is vomiting. My wife had a tummy ache or a headache. But these pharmacists, actually, 75% of them are not even qualified to be a pharmacist, let alone an actual medical doctor. So what we've done, you now can go to your pharmacist and get connected to an actual qualified doctor instead of and avoid medical malpractice, inaccurate diagnosis, and then eventually costly treatment. So your pharmacist can connect to you remotely via telemedicine to a qualified doctor, and then get medicine that your actual qualified doctor prescribes.
And what's in it for the pharmacist? Like, because obviously if somebody goes to a pharmacist and they just want to buy something, surely they just want to sell it.
Yeah.
What's in it for them?
Of course. Kuhinoor, 85% of qualified doctors are actually based in city. But a population in Bangladesh of 170 million population, 61% of that lives outside of the city. So that creates a big gap for both for patients to access doctor regularly and for doctors to reach out to or have a wider patient's case, right? And you'll be surprised to know that doctors are willing to give out 30 to 50% of their consultation fee for those who refer.
Oh, wow.
So
okay.
now pharmacists earn income twice. One is earned referral fee when you refer to a doctor, because patients are not paying you anything different. Patients are paying the doctor. Doctors are paying you a referral fee out of the consultation fee. Second, sell the actual medicine apart from paracetamol that the doctor is actually prescribing. So we are creating income. We're generating an income stream for pharmacists. And you will be also surprised to know that a lot of our agents that we currently work with, they end up hiring assistants and secretaries to help them manage these patients. And they are trained. They are trained as virtual medical assistant to help doctors assist with remote diagnosis, for instance.
Yeah, do you know what? It's incredible that I mean, it's a win-win situation.
Yeah,
it's a win-win situation. So, what is? I guess I'd be keen to understand, what is it like in Bangladesh at the moment? How many people have you reached so far in with this?
So we've launched in February 2024, and we are currently present in 181 villages.
Wow.
We've onboarded 250 agents. And these 250 agents ended up hiring more sort of, their partners. Sometimes the agents also invite their wives as well to help female patients with their sort of, diagnosing when they're talking to gynecologists. So overall, we created jobs for 600 people now. We've successfully treated 5,000 patients. And we've connected 50,000 patients with actual provider. Now, provider can be qualified doctor, hospitals, diagnostic centers, pharmacists, pharmaceuticals, for instance, ambulance as well. We also offer emergency services like blood bank and ambulance service. So, and that's, I think, is a record number. Within 6 months, we've been able to reach so many. So you can understand the need of it.
Yeah, no. Do you know what's interesting is you've made such an impact in such a small space of time. What's your vision for Soowgood?
That's a good question. So my main mission with Soowgood is to digitize the entire healthcare ecosystem. Why? In Bangladesh, first of all, there are a lot of good doctors, qualified doctors. The problem is, Kuhinoor, there's lack of access to information. Patients actually don't know who to go to, right? And did you know that Singapore and India has the highest medical tourism from Bangladesh? So Bangladeshis have enough money to spend to doctors outside, whereas we have so many good doctors in our country. So have that access to information. Second is have a digitized sort of medical central database so that whoever doctor you go to, your doctors can know about you as a patient. And that obviously improves diagnosis.
Of course, of course. I mean, if you think about it, if people are just going randomly anywhere, you don't have any record of it. And, and yeah, no, that definitely helps. Can I just ask, as a female founder, how has it been for you? What has been the challenges in doing this?
You know, there are a lot of sort of cliches that as a female founder, you have it hard, right? You have it difficult, but I actually haven't. I have been able to sort of make such great connections, whether it's with parents at my tuition center, whether it's with, students in Paris, Bangladeshi students, North African students, Filipino students who understand sort of, and of course in Bangladesh as well. But the main challenges have been not because I'm a female, it's something else. It's been because of, I grew up in London, right? Yeah. So that cultural difference, I worked in London. I understand what it is to run a company in London or Paris. But the cultural difference between working in UK or Europe and working in Bangladesh is different. Now, all of a sudden, I have to understand what motivates Bangladeshi people. How can I lead them, for instance? How can I get them to be as passionate about this project? So that's been a core problem, is to get a core team who, sees the vision as me and able to agrees to take a risk, right?
And how are you finding that, adapting? You said, there's a cultural difference. Yeah. How are you finding that? Are you visiting a lot or?
Yes. Yeah. So I am visiting a lot. I'm observing a lot. There are hierarchical sort of cultural thing in there where, you don't speak to the boss directly and things like that don't exist here. Yeah. Yes, I'm also reading some books also and watching videos and sort of, but most of it is really observing when I go there.
We are running out of time. And before we go, I just want to understand from you what's next for you and for Soowgood.
Yeah. So currently we are working in villages. We do want to move to all over Bangladesh. Currently, we're working in 4 districts, in Chittagong, Munshiganj, Chapai-Nawabganj and Rajshahi. We do also want to go to the east, north side and the central, and also the urban area, and create a sort of a centralized platform where anyone can access whatever sort of healthcare need they have.
Oh gosh, so, honestly, Sanjida, you are incredible, and honestly, I feel inspired by you. And I'm sure there are so many, not just girls, boys who are watching you now and feeling inspired to do better and to do more, especially in Bangladesh. Thank you so much for coming in. I can't believe we've run out of time. And again, I could easily just speak to you for hours about this. Thank you so much.
Thank you very much.